That I'm a better fit. I represent the views of our residents. She has been recalcitrant to answer our residents' phone calls, emails, letters, complaints. They have not been taken care of. She does not put residents first. To me, the City Council is a public service agency. We are the service center for our residents. And if they have a problem, we need to be in touch with them and help them.
Welcome to Beyond the Headlines. I'm Jeff Powers. We're pleased today to be joined by Dr. Jen Campbell. Dr. Campbell is running in District 2. She was one of the top 2 vote getters in the June primary, and she is running against the incumbent Lorie Zapf, and she joins us now on Beyond the Headlines. Great to have you.
Thank you very much.
For those who aren't so much aware about yourself, this is the first time you've entered into politics. You did quite well in the June primary. Tell us a little bit about yourself.
Well, I'm a physician. I just retired after 37 years in December. And I was very taken with how poorly the city responded to the hepatitis A epidemic, and I decided to run for city council. Yes, I immediately became active in San Diego the day after I arrived. And
where are you from?
Born and raised in Colorado.
Okay.
Moved here from Pittsburgh, Pennsylvania.
Politically active, you said, right when you arrived.
Yes. My family was very active in the community. They were activists. My mom was active in the Democratic Party, grassroots level up to the national level. John Kennedy used to call her for advice. I got to talk to him on the phone when I was a kid.
It's not bad.
Yeah. So she trained all us children about the importance of being active in society and taking our part in democracy. If you're wealthy, 125% of houses are available for what you can afford. If you're not wealthy, you're out of luck. The middle class and the people below that, as far as income level go, it's hard to find a home they can afford. So it's a matter of supply and demand. We have a much higher demand than supply. In the last several years, we haven't been building as much housing stock as we need, and we need to improve upon that. Well, first of all, it is solvable. Many cities in our country have tackled this problem, and they've had 90% success in keeping previously homeless people permanently housed and becoming giving members of society again. So yes, it is definitely solvable. We just have to have the will and the way. We have 5 criteria that have been used in other places successfully. The first step is collaboration. The second step is outreach. The third step is to identify the buildings available for housing. And the fourth step is called wraparound services. And the fifth step is to observe and monitor so that things are working correctly. And it works very well in the cities that have done it. But the thing about it is it's actually much less expensive to help house the homeless and help rehabilitate than it is to pay for them on the street. It costs about 1/3 as much, these cities have found.
Okay. The issue with the Hep A crisis really took the community by storm in that there was just inaction happening. And it just seems like we're still sort of stuck in this place where we're running in place. We're not really providing the solutions necessary for the community.
Well, I think we just need more leadership. We need the political will. We need the leaders to stand up and say, we can resolve this problem and we need to do it. And the Hep A outbreak was entirely predictable. 2 grand juries have told the city over decades that they really need to take care of the public hygiene. And they didn't. They didn't listen. So what happens is when you have an infectious disease, the caseload doubles. The normal caseload, which is only a few cases a month, doubles in San Diego. It's time to call an epidemic, an emergency, and to get busy to stamp it out before it spreads. And they didn't do that. They should have started in March 2017 when they had about a dozen cases. They waited till they had 434 cases and 16 people dead. And that is the wrong way to go about stopping an epidemic. And that's what really got me going as a physician, because it just was mishandled totally. I couldn't believe in a first world nation that a response would be that poor to a public health crisis.
Are you in favor of the council's plan and the action the council took?
Yes, I
recently?
think the council came up with a good compromise.
Mm-hmm.
The compromise, the idea that people who have a home and they have room to rent a room and they want to do this on an internet platform, they can do it. And it'll be regulated and followed and taxed and properly controlled by the city. That way we won't be losing our neighborhoods. But people who need help with their income level, they've got another way to do it. Well, the first thing is that she is a Trump Republican. Our district only voted 30% for Trump, 70% for Hillary. So she doesn't fit the district politically. Second of all, she completely disagrees with most of the residents of the district in many ways. She is anti the legalization of recreational marijuana. And this is not, our district voted 68% in favor of recreational marijuana. So she's out of step there. She's out of step in many ways. And I believe that I'm a better fit. I represent the views of our residents. She has been recalcitrant to answer our residents' phone calls, emails, letters, complaints. They have not been taken care of. She does not put residents first. To me, the City Council is a public service agency. We are the service center for our residents. And if they have a problem, we need to be in touch with them and help them.
Dr. Jen Campbell is our guest on Beyond the Headlines. She is a candidate for the District 2 City Council race. She is running against the incumbent Lorie Zapf, and she's been our guest on Beyond the Headlines. Thank you so much for joining us. Great to have you. Great to meet you. It's really a pleasure.
Thank you. Nice to meet you.
Yep.